This is the final in a series of meetings that I've had across the state talking about the potential impact of Medicaid cuts and what's happening at the federal level. And what I've heard is absolutely devastating in terms of the impact on New Hampshire residents if Medicaid gets cut at the level that the House and Senate majority are talking about cutting it. $880 billion over the next 10 years. That would have a huge impact on the 1 in 7 people in New Hampshire who rely on Medicaid for their health care, for people in long-term care, for children to get the treatment and health care they need, for families who rely on services, and for the disabled who are enrolled in health care, and for Granted Advantage, people who get their health insurance through the Granted Advantage program that's funded to a great extent by Medicaid. So we know that there are about 185,000 people in New Hampshire who would lose out if Medicaid gets cut. And I've heard those stories from Berlin to Claremont to here in Concord to the Lakes region. People talking about how they depend on Medicaid to be independent, to work. I heard from 2 mothers up in Berlin who have adult children who are able to work part-time despite their disabilities because their mothers can qualify for a Medicaid stipend to support them in their jobs. And without that Medicaid, all of those folks would be left home without the ability to work, without the ability to get around and contribute to their community. I heard from a mother from the Seacoast who has twins, one of whom was born with significant health and developmental issues, who has 14 specialists that they're able to afford because he's enrolled in Medicaid. Without that, they have no way to pay for those healthcare costs to keep him healthy. Story after story like that I heard from people who are dependent on those Medicaid funds. So we cannot let this happen at the federal level. We all have to do everything we can to fight these cuts, because not only does it mean that people will not get the support and the health care and the services they need, but it will have a huge economic impact on our communities. The fact is, cutting Medicaid doesn't save money. It costs money, and we need to remind people of that. I hope you'll help me in this effort.